The ESR iGuide is a clinical decision support tool, which means it's an IT product that allows to use the existing guidelines that we have had for many, many years and no one is using, for the referrals especially. In this format, we are allowed to provide the guidance to the referrals at the point of care and immediately after they are requesting for examination, giving him or her a feedback. The importance of this is that it can be a change management because we know that about between 20 to 30% of examinations we are performing are useless. And this is, we think, the only way to diminish this waste in our system and this harm for the patient. The ESR iGuide portal, in fact, is the version, let's say, the more accessible version of the clinical decision support tool. So you can access the portal, you can introduce the clinical data or the clinical situation or symptoms of the patient and get a feedback. We know that this is not the best way to use the clinical decision support because to be fully operational has to be integrated in the electronic request system, and then they have the full potential for change management. But we thought from the ESR point of view that we take care of the contents of these guidelines, of this ESR iGuide. There could be a nice way for our members to check about what the guidelines are recommending for specific clinical situations. And second advantage is that for developing countries and the places in the world, or even in Europe, that they don't have these electronic ordering systems, to start using the concept of clinical decision support in a very easy manner and for free, which is a good deal. Well, in the new directive, there are several situations that you have to face about optimization, about education, about communication, but this one is quite difficult. This is justification of the examinations. We are supposed to justify every single examination we are performing to the patients in our department. As you can imagine, in a department like ours, that we are close to 400,000 examinations per year, it's it's impossible to justify every single one of these examinations. Using the decision support, the ones that are in the greens, that means that are prepared, we can take it for a proof and we take it for justified, and we're trying to convince the authorities that it would be an excellent tool in order to advance in the compliance with a new directive. Regarding the implementation, this is not an easy matter because we have to take into account a lot of variables. Drivers like payment systems, like how to engage the referrals and the societies, or the subspecialty societies or the specialty societies is not an easy thing. But we are doing the first step. We are quite happy with these first steps. But this is going to be a work in progress for the next years to come. And not only this clinical decision support, we will not only for referrals, but be also for radiologists and for the clinical specialties.